Hello everyone, myself lecturer Aditi Anil Kushare, Master of Pharmacy in Quality Assurance Techniques. Today we are going to discuss about the experiments from Pharmaceutics 2. So we will discuss about the introduction to solid dosage forms, that is powders and other oral unit dosage forms. The solid dosage forms are available mostly in unit dosage forms such as tablets, capsules, cachets, powders or tablet triturate. Powders. The pharmaceutical powder is a mixture of finely divided drug and or chemical in the dry form. They are solid dosage forms of medicament which are meant for internal and external use. Classification of powders are bulk powder for internal use, bulk powder for external use, simple and compound powder for internal use, powders enclosed in cachets and capsules, and fifth one, compressed powders, that is tablets, that are also known as tablet triturates. So first one we will discuss about the bulk powder for internal use. Powders are dispensed in bulk when accuracy of dosage is not important. They are supplied in the wide mouth container that permit the easy removal of spoonful of powder. Examples of that bulk powder for internal use are rhubarb powder, BPC, that is known as a Gregory's powder, compound bismuth powder. Second one, that is a bulk powder for external use. These are non-potent substances. These powders are supplied in a cardboard, glass or the plastic container. The dusting powders are supplied in a perforated or the sifter top container. The classification of this bulk powder for external use is first of all dusting powder, then insufflation, snubs and dentifrices. We will discuss about dusting powder. These are generally applied to the skin in very fine state to avoid the local irritation. Hence, the dusting powders should be passed through sieve number 80 to enhance their action. Classification of dusting powder is medical and surgical. There are two classes. We will discuss about a medical. These are used mainly for superficial skin conditions and sterility is rarely essential. Medical dusting powders are not intended for application to the open wounds or areas of broken skin. Surgical one, these are used in the body cavities and major wounds on burns and on the umbilical area of infants, hence they must be sterile. Insufflations. These are medicated dusting powders meant for introduction into body cavities such as nose, throat, ears and vagina with the help of apparatus known as insufflator. Insufflations should be finely divided powders so that a stream of fine particles of medicaments get applied to the site of application. Snubs. These are finely divided solid dosage forms of medicament which are inhaled into the nostrils for its antiseptic, bronchodilator and decongestion action. Snubs are dispensed in the flat metal boxes with the hinged lid. Then next one, fourth class, that is dentifrices, which is tooth powders. These are applied with the help of toothbrush for cleaning the surface of the teeth. They contain the suitable detergent or the soap. Some abrasive substances such as calcium sulfate, magnesium carbonate, sodium chloride are used in the fine powder. A strong abrasive substance should not used as it may damage the tooth structure. Then next, third class, that is the simple and compound powder for internal use. This is the main class of the powder. Each individual dose is enclosed in the paper. In the divided powders, the number of ingredient may be one simple powder or more than one, that is compound powder. The minimum quantity of powder should not less than 100 mg. Simple powder. A simple powder contains only one ingredient either in a crystalline or the amorphous form, which should be reduced to fine powder and wrapped as individual doses. Compound powders. Compound powders contain the two or the more than two substances which are mixed together and divided into desired number of individual doses. Fourth one, that is powders enclosed in cachets. Cachets are the solid unit dosage form of the drugs. These are molded from rice paper. They are used to enhance the nauseous or the disagreeable powders and are available in the different sizes to hold the drugs from 0.2 to 15 gram of powder. Cachets are of two types, that is wet seal cachets and dry seal cachets. Direction for this is immerse in water for few seconds and swallow with a draught of water. Then fifth one, that is a tablet triturates. These are the powders molded into the tablets. Molded tablets are flat circular disc, usually contain a potent substance which is mixed with lactose, dextrose or some other suitable diluent. Packaging and storage of these tablet triturates are packed in an airtight container to protect from moisture. General method of preparation of powders. During the powdering, weighing and mixing, there is a loss of powder which cannot be avoided. Therefore, calculate the quantity for one extra powder than required. It is difficult to weigh the quantity less than 2 grain or 100 milligram. As we know, 1 grain is equal to 60 milligram. On dispensing balance, therefore, this quantity must be triturated with a suitable diluent such as lactose. The crystalline substances are powdered separately and then weigh the required quantity of ingredient. Mix all the ingredients in the ascending order of their weight and mix thoroughly to obtain a homogeneous powder. Mixing of powders. Powders may be mixed by one of the following methods, that is a spatulation, trituration, geometric dilution, sifting and tumbling. Dispensing of powders involving special problem. A number of problems arise while dispensing a powder containing volatile substances, hygroscopic and deliquescent powder, eutectic mixture, efflorescent powders, explosive substances and potent drugs. So special considerations are done while dispensing such powders. Volatile substances. First problem is for the volatile substances. The volatilization of substances like menthol, camphor and the essential oils may take place. Incorporation in the powders or should be wrapped in the wax paper and outer wrapper may be any thick paper. Then second one, for hygroscopic and deliquescent powder, the powder which absorb the moisture from the atmosphere such as ammonium chloride, iron and ammonium citrate, pepsin, phenobarbitone, sodium bromide, sodium iodide. Such substances are supplied in the granular form or should be double wrapped. For deliquescent substances, wrapping in ammonium foil or plastic cover is advisable. Third one, that is for efflorescent powder. Some crystalline substances become wet or liquefied during trituration. For an example, caffeine, citric acid, ferrous sulfate, etc. This difficulty may be overcome by using the anhydrous salt or an inert substance. Eutectic mixture. When two or more substances are mixed together, they liquefy due to the formation of a new compound which has a lower melting point than room temperature. Example, menthol, thymol, camphor, salol, etc. An equal amount of any inert absorbent like magnesium carbonate, light magnesium oxide, kaolin, starch, lactose is mixed with eutectic substance. Packaging of powder for divided dosage form for internal use should be done appropriately. Double wrapping. White demi paper gives inadequate protection to volatile, hygroscopic and deliquescent substances unless it is lined with grease-proof paper. If greater moisture resistance is required, use waxed paper. The inner paper is cut a few mm smaller each way than the white demi and it is satisfactory to fold both the papers together. Sometimes it is necessary to wrap each packet externally in a aluminium foil. So in next session we will discuss about the actual experiment. Experiment number 76. Title of this experiment is to prepare and submit the powder of 10 packets. In this we are going to study the solid dosage forms for internal use. Proposition 1. Powders can be packed in the individual doses for uniformity of dosage. And proposition 2, that is double wrapping is necessary for powders containing volatile or hygroscopic substances. Learning objectives are to understand the purpose and method of preparation of divided powders and ability to prepare and wrap divided powders in the correct manner. Apparatus required are mortar, pestle, spatula, white paper, wax paper. Factor calculated as quantity required upon quantity given, that is we have the quantity required to prepare 10 packets of that powder and quantity given should be for the 12 packets of powder. So 10 upon 12 is equal to 0.83. We have, this is a prescription given over here in the Latin terminology. This is denoted by the symbol Rx. This is the prescription. Let's discuss in detail about the formula table. That is type means category, user, role of ingredient. Translation means the name of ingredient. Quantity given in the imperial system, that is in this Latin terminology. Quantity given in metric system for the 12 packets of the powder, and quantity taken in metric system to prepare the 10 packets of powder. So first of all, we have aspirin, which is used as an analgesic. Quantity given in imperial, that is a 5 grain. 5 grain, as we know, 1 grain is equal to 60 milligram. So 5 into 60, that is equal to 300 milligram. That is equal to 0.3 gram. And the quantity taken in metric system to prepare 10 packets, that is 0.249 gram. So this quantity should be calculated with the help of factor. Then citric acid, which is used as a flavoring agent and preservative also. The quantity given in the imperial system is 1/2 grain. 1/2 grain. 1 grain is a 60 milligram. So 1/2 into 60, that is equal to 30 milligram, is equal to the 0.03 gram. And the quantity taken to prepare 10 packets, that is 0.0249 gram. Calcium carbonate, used as an antacid. Quantity given in the imperial system is 1 and 1/2 grain. That is 1 and 1/2 grain. 1 grain is equal to 60 milligram. So 1 into 1 and 1/2 into 60 milligram, that is equal to 90 milligram, is equal to 0.09 gram. And the quantity taken in the metric system to prepare up to for the 10 packets, that is 0.0747 gram. All these taken quantities are calculated with the help of factor. Direction for internal use only, and to be used as directed by physician. So we have, this is acetyl salicylic acid, that is aspirin, which is a previously weighed. This is the citric acid, which is previously weighed, and this is the calcium carbonate, which is previously weighed. So, and this is a mortar pestle. Now all these are in the powder form. So I am going to first of all take this calcium carbonate and this citric acid into this mortar pestle and proceed for trituration of both of these powders into this mortar pestle. After proper mixing into this mortar pestle, now I am going to add this aspirin, that is acetyl salicylic acid, into it and incorporate all the acetyl salicylic acid, aspirin into this previously added 2 powders. And after proper mixing, then I am going to transfer this formulation of powder into this container, and then we will proceed for next labeling part. So we will move towards labeling of formulation. Powder containing 10 packets. For ABC means name of patient, register number, that is XYZ means number given in the register, dispensed by PQR, that is name of pharmacist, manufacturing date September 2020, store in cool and dark place, for internal use only, to be used as directed by physician, manufactured by Element Pharmacy, Nashik. Result, the 10 packets of this powder is submitted in this white mouth bottle. The instruction on label as for internal